Most people believe diabetes can only be detected through a blood test. You visit your doctor, the lab results come back, and that is how you find out. I completely understand why people think that. For years, that is exactly what my own patients told me too. My name is Dr. Stanley Brown, and I have been practicing medicine for over 20 years. What I have learned, what I see confirmed in my office every single week, is that your body begins warning you about elevated blood sugar, long before any laboratory result ever would. And the very first place your body speaks up is your feet. The reason I am making this video today is because of how many patients I have watched walk into my office, or worse, into an emergency room, carrying every warning sign for months, sometimes years, without ever understanding what they were looking at. Today, I am going to change that for you. Just last month, I sat across from a patient, a 67-year-old retired gentleman who maintained what he considered a healthy lifestyle and genuinely felt fine. He arrived for a standard checkup, but before a single blood draw was ordered, I asked him specifically about his feet. His response was casual. His feet had been somewhat numb for a while, but he had written it off as a natural part of aging. Before we even opened his chart, he already had 4 of the 9 signs I am about to walk you through. When his fasting blood sugar result came back, it read 214. He was diabetic. He had been diabetic for over 2 years without the faintest awareness of it. What I am sharing with you today is precisely what I shared with that patient. 9 warning signs already present on his feet and on millions of other feet at this very moment that almost nobody on earth recognizes for what they genuinely represent. For every single sign, I will tell you 3 things. What most people assume it is, what is actually taking place inside the body, and 1 concrete daily habit that can actively protect you. The American Diabetes Association estimates that 1 in every 5 Americans living with diabetes has absolutely no idea they have it. That translates to over 8 million people going about their daily lives right now, while a silent condition systematically damages their nerves, deteriorates their kidneys, erodes their vision, and, yes, destroys their feet. The encouraging reality is that a $12 blood test can intercept this at an early stage. But before that test means anything, you need to know what your body has already been trying to show you. So, let us begin. Sign number 1 is something the overwhelming majority of patients have already personally experienced, and every single one of them has found a convenient explanation for it. Tingling, numbness, that familiar pins and needles sensation spreading through the feet. Without exception, patients tell me their foot simply falls asleep occasionally. They were sitting with their legs crossed. They were in an awkward position. And truthfully, that does happen to everyone from time to time. But my follow-up question is always the same. Is this occurring regularly with no clear physical explanation? Because when the answer is yes, the conversation needs to go somewhere entirely different. Frequent recurring numbness and tingling in the feet, the clinical term being peripheral neuropathy, represents one of the earliest detectable signals that blood sugar has been running at damaging levels for a sustained period. The excess glucose circulating in your bloodstream initiates a slow, relentless attack on the outer protective sheath surrounding your nerve fibers. Because the process is gradual and progressive, most people never identify the pattern until significant damage has already accumulated. The comparison I return to again and again with my patients is this. Picture your nerves as electrical wiring running through your body. Every wire is encased in a protective plastic coating. That coating is what guarantees a clean, uninterrupted signal traveling from your brain all the way down to your foot. When blood sugar remains chronically elevated, it functions like a corrosive acid, slowly dissolving that coating from the outside in. The wire continues carrying signals for a while, but the quality degrades. The transmission becomes unreliable, fuzzy, distorted. That distortion, that imprecise, intermittent sensation, is the tingling you feel in your feet. According to the American Diabetes Association, peripheral neuropathy affects close to 50% of everyone diagnosed with diabetes. It stands as the single most prevalent complication of the disease, and it almost universally originates in the feet before spreading anywhere else. This means that right now tens of millions of Americans are experiencing this exact tingling sensation and attributing it to something trivial. Do not be among them. My standing daily recommendation for every patient over 60: a 20 to 30-minute walk without exception every single day. Not running, not intense exercise, walking. Consistent movement is the most powerful tool available for maintaining adequate circulation to your feet and preserving the function of those nerve endings. Alongside that, begin eliminating added sugar from your diet starting today. Not after the weekend, not next month. Today. Sign number 2 is consistently described by my patients as the most psychologically distressing of all 9, and the reason is timing. It does not arrive during the activity of the day when distractions are plentiful. It arrives at night in the quiet darkness, when you are lying still with nothing to occupy your mind and nowhere to direct your attention. Many patients attribute this sensation to spending too long on their feet, to summer warmth, to general end-of-day fatigue. Occasionally, they are correct. But when a patient tells me their feet feel like they have been set on fire, specifically at night while they are horizontal and attempting to sleep, that description immediately commands my full clinical attention. Burning pain concentrated in the soles of the feet, particularly during nighttime hours, is a textbook early manifestation of diabetic neuropathy. The mechanism is straightforward once you understand it. The nerve fibers in your feet have sustained damage from prolonged glucose exposure and are now generating and transmitting completely incorrect electrical signals to your brain. Your brain receives an unambiguous heat message despite the fact that absolutely nothing warm is in contact with your foot. The nerves are not responding to external reality. They are misfiring based on internal damage. The analogy that makes this immediately clear is a fire alarm with a defective sensor. The building is structurally sound. There is no fire anywhere. But the alarm is screaming continuously because the sensor itself is broken and no longer distinguishing real threats from phantom ones. Your nervous system in this situation operates identically. The burning sensation you experience is not originating from any external source. It is being manufactured entirely within damaged nerve tissue that has lost the ability to accurately report what is happening. Research documented in the journal Diabetes Care established that burning foot pain ranks among the earliest reported symptoms in patients subsequently diagnosed with type 2 diabetes, in many cases appearing 1 to 3 full years before any formal clinical diagnosis. 2 specific habits I consistently recommend for this sign. First, commit to consuming at minimum 8 full glasses of water every day. Sustained adequate hydration supports your kidneys in eliminating excess glucose from circulation and provides essential nourishment to stressed nerve tissue. Second, incorporate significantly more fiber into every meal without exception: vegetables, legumes, whole oats, and similar sources. Dietary fiber actively decelerates the rate at which sugar enters your bloodstream following a meal, which is precisely the biological relief those damaged nerve fibers are requiring. Sign number 3 demands your absolute closest attention, because this is the point where the situation transitions from uncomfortable to genuinely life-altering. This is the sign responsible for sending more of my patients to emergency rooms than any other on this list. They arrive and describe a small blister that formed from their shoe approximately 3 weeks prior. It is not healed. They waited patiently. They assumed the body would handle it independently as it always had before. The critical distinction is this: most minor wounds do resolve without intervention, but that biological process depends entirely on a properly functioning circulatory system, and elevated blood sugar fundamentally dismantles that system. When blood glucose is chronically elevated, your body's wound-healing capability undergoes a dramatic and dangerous deterioration. The blood vessels distributed throughout your body, including the microscopic capillaries serving your feet, progressively narrow and lose their elasticity. The direct consequence is that oxygen, white blood cells, Growth factors and the complete spectrum of nutrients required to rebuild damaged tissue are physically unable to reach the injury site with sufficient speed or volume. The wound remains exposed, undefended, and stagnant. Visualize attempting to irrigate a garden through a hose with a severe kink blocking the flow. The water supply is abundant. The problem is entirely in the delivery. Elevated blood sugar creates precisely that kink in the vascular system of your feet. Every biological ingredient needed for healing is present in your bloodstream. The infrastructure to deliver it has been compromised. And a wound that cannot close is not simply a wound anymore. It is an active invitation for bacterial infection to establish itself. The Centers for Disease Control has documented that diabetic foot ulcers represent the leading cause of non-traumatic lower limb amputations across the United States, accounting for over 100,000 procedures annually. Tracing virtually every one of those cases backward reveals the same origin point, a small wound that was dismissed and left unattended. Beginning tonight, following your bath or shower, sit in good light and conduct a systematic examination of both feet in their entirety. Examine between every individual toe. Inspect your heels from every angle. If you discover any cut, blister, abrasion, or area of broken skin, clean it thoroughly with mild soap and water, apply an antiseptic solution, and keep it covered and protected. If meaningful improvement is not visible within 48 hours, contact your physician. Not at your next scheduled appointment, not next week. Within 48 hours. Sign number 4 has been in plain view the entire time. It is visible. It has been present. Most people pass it without recognition every single day, and the overwhelming majority never establish any mental connection between what they are seeing and the state of their blood sugar. Patients observe that their feet appear darker, more reddish, or discolored, and offer explanations. Sun exposure, naturally darker complexion on the ankles, circulatory quirks they have lived with for decades. Some of those explanations are valid, but there exists a precise and clinically recognizable pattern of skin discoloration, concentrated particularly in the ankle region, that I specifically search for during any assessment involving blood sugar risk. When the circulatory system is compromised by sustained elevated blood glucose, the lower legs and feet are systematically deprived of the fresh, oxygenated blood they require. The skin responds to that deprivation by changing color. Depending on the individual and the severity of the compromise, you may observe deepening pigmentation, an intense reddish hue, or, in more advanced cases, a distinctly bluish tint settling around the ankle and lower foot. This visible color change is your integumentary system communicating directly and unmistakably that blood supply to that region has become critically inadequate. In certain patients, the affected skin simultaneously becomes noticeably thinner and more fragile, an additional visible confirmation that underlying tissue is being deprived of proper nourishment over an extended period. The explanation I offer my patients to make this concrete: picture your circulatory system as a logistics network of delivery vehicles transporting oxygen and essential nutrients to every tissue in your body. Your feet occupy the position at the absolute furthest point of the longest delivery route in your entire anatomy. They are geographically the most remote destination from your heart. When the roads serving that destination narrow and deteriorate due to blood vessel damage, the deliveries arrive late, arrive depleted, or cease arriving altogether. Tissue starved of oxygen changes color visibly and unmistakably. It is a distress signal broadcast on the surface of your skin that requires only knowledge to interpret. A study featured in the Journal of the American Academy of Dermatology established that these characteristic skin changes are detectable on average 18 months prior to a formal diabetes diagnosis being made. The daily protective habit for this sign: 5 dedicated minutes every single morning performing ankle circles, toe raises, and calf stretching. Even that relatively modest investment in movement generates meaningful improvement in blood delivery to the extremities. For individuals whose mobility is restricted, elevating the feet moderately while seated produces comparable circulatory benefit. Sign number 5 is consistently the one that produces the greatest surprise when I explain its significance, because to every patient who has it, it appears not just harmless but entirely ordinary. Most have carried it for years and formed not a single mental association with blood sugar or nerve health. The statement I hear with remarkable regularity, "My heels crack every winter without fail. It is simply dry skin, always has been." That explanation is entirely reasonable for seasonal, mild, moisture-responsive heel cracking. But when the cracking is severe, when it persists or worsens in the heat of summer, when generous and consistent application of moisturizer produces no meaningful relief regardless of the product or frequency, that symptom profile belongs in an entirely different clinical category. Diabetes exerts a specific and damaging effect on the autonomic nervous system, the network of nerves governing the countless automatic biological processes your body performs continuously without your conscious direction or awareness. Among those processes is the precise regulation of moisture production and perspiration distribution throughout the skin. When autonomic nerve fibers sustain damage from chronic glucose exposure, the sweat glands embedded in your foot tissue lose their ability to function in a coordinated, regulated manner. Your feet begin losing their intrinsic moisture supply from within, rather than from the external surface. No topical application can substitute for or replicate that internally generated moisture. The root cause is neurological, and no amount of cream or oil applied externally resolves neurological damage. The architectural analogy that makes this mechanism clear: envision your skin as a carefully constructed wall designed to maintain a sealed, protective surface. When the autonomic nerves governing that wall's integrity are compromised, the structural binding between the layers begins to deteriorate. Fractures develop. And those fractures appearing in the skin of your feet are not a cosmetic inconvenience. They are physical breaches in your primary barrier against the external environment, open pathways through which bacteria can enter directly into tissue that already suffers from impaired blood flow and compromised immune response. In a foot with restricted circulation, an infection entering through a heel crack can escalate with alarming speed and severity. I have sat with patients whose heel fissures were deep enough to bleed actively. Patients who informed me with genuine bewilderment that they had been faithfully applying moisturizer twice daily for 2 full years without any improvement whatsoever. That is categorically not a dermatological problem. That is neurological damage expressing itself through the skin. The American Podiatric Medical Association formally identifies chronic, treatment-resistant heel cracking as a clinically significant indicator of autonomic neuropathy in older adults, a condition with a direct and well-documented causal relationship to prolonged elevated blood sugar. Autonomic neuropathy is not a minor quality of life inconvenience. It is unambiguous clinical evidence that the nervous system is operating under serious and sustained physiological stress. Apply a quality moisturizer or pure coconut oil to the entire sole and heel of each foot every single night before sleep. Be thorough and consistent. However, never apply any moisturizer between the toes. Moisture trapped in that confined space creates precisely the warm, damp environment in which fungal organisms thrive and proliferate. Additionally, maintain your commitment to 8 glasses of water daily. Your skin's hydration depends as critically on internal fluid intake as on any external application. I want to stop here for just a moment before we continue. 5 signs have been covered, and I want to ask you something directly and personally. Have you recognized any of these signs in yourself? Have you noticed them in someone whose health matters to you? A spouse, a parent, a brother, or sister? If the answer is yes for even a single sign, go directly to the comment section right now and type the word YES. Just that one word in capital letters. Nothing else required. Every comment on this channel receives my attention. Every single one. If a question is forming in your mind, ask it openly. If a concern is building, tell me directly. That is the fundamental purpose behind this channel. Not a one-way broadcast, but a genuine, ongoing conversation about your health. And if this content is delivering value to you, tap the like button right now. 1 second of your time signals to the platform that this information matters and extends its reach to more seniors who need it tonight. Sign number 6 carries more clinical weight than its appearance suggests, because what it reveals extends well beyond your feet. It reflects simultaneous damage occurring in an organ most people would never connect to swollen ankles. The near-universal explanation I receive from patients presenting with this sign: I am on my feet all day at work, or I sit at a desk for hours without moving. The swelling is positional. Swelling that arises from and resolves with changes in activity and position is genuinely normal and requires no concern. The situation that demands serious attention is this: feet and ankles that are persistently swollen, that greet you with visible puffiness each morning, that leave unmistakable deep impressions from your socks every single evening. That pattern tells a fundamentally different story. Chronically elevated blood sugar inflicts progressive damage on the kidneys. The kidneys bear primary responsibility for maintaining the precise fluid balance your body requires to function. When kidney filtration capacity is impaired by years of glucose toxicity, excess fluid accumulates by gravity in the most inferior regions of your body, your feet and ankles. This accumulation, clinically designated as edema, is a visible, palpable indicator that your body's most critical filtration system is operating under significant and mounting stress. The explanatory framework I use with patients: your kidneys function as the central water treatment facility for your entire body. Every drop of blood in your circulatory system passes through that facility to be purified and chemically balanced. When sustained high blood sugar damages the filtration membranes within that facility, the system begins backing up. Excess fluid accumulates with nowhere to go except downward under the influence of gravity. It settles into your ankle tissue. When you press a fingertip firmly into that swollen area and release it, the depression remains visible for several seconds before slowly filling back in. That specific response has a clinical name: pitting edema. And it is a finding that should never be minimized or attributed to a long day on your feet. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in every 3 adults carrying a diabetes diagnosis, and that visible swelling in the lower extremities is frequently the earliest externally observable indicator that kidney filtration function has begun to deteriorate. When resting at any point during your day, elevate your feet above the level of your heart. A standard pillow provides adequate height to encourage the accumulated fluid to redistribute away from the extremities back toward your body's central circulation. Simultaneously, make a committed and sustained effort to reduce sodium in your daily diet. Dietary salt directly promotes fluid retention throughout your body, which substantially amplifies edema in individuals already experiencing compromised kidney function. Develop the habit of reading nutritional labels with attention. The sodium content hidden in canned goods, packaged soups, processed meats, and prepared foods routinely far exceeds what most people anticipate. And, if the swelling you are experiencing is new in onset, is progressively worsening, or is accompanied by any other concerning symptoms, bring it explicitly to your physician's attention at the earliest possible opportunity. This is not a symptom to monitor passively. Sign number 7 holds the distinction of being the most consistently misdiagnosed finding on this entire list, a pattern I observe with particular frequency in male patients. By the time the accurate diagnosis is finally established, these individuals have typically been self-treating and symptom-suppressing for months, or in some cases years. The account I receive with near-complete consistency: I have been managing the foot pain with ibuprofen for several months now. I was certain it was arthritis flaring up or an old athletic injury reasserting itself. That history is sometimes entirely accurate, but sometimes, and this is the critical distinction. The pain has an origin that anti-inflammatory medication is constitutionally incapable of addressing because the source is not inflammation. It is neurological. When nerve fibers sustain chronic damage from persistently elevated blood glucose, they do not universally respond by going silent and producing numbness. In a significant subset of patients, the opposite occurs. The damaged nerves become pathologically hyperactive. Rather than transmitting reduced or absent signals, they begin generating and broadcasting intense, random, unprovoked electrical signals that the brain translates as severe acute pain. Patients reach for vivid language to describe what they experience. Stabbing, an electric shock discharged through the foot without warning, a burning needle inserted and twisted. This phenomenon concentrates predominantly in the nighttime hours when the absence of competing sensory input from daily activity leaves the nervous system's aberrant signaling fully exposed and unmasked. The mechanical analogy that captures this precisely: a vehicle alarm system that sustained damage in a minor collision. At random intervals throughout the day and night, it activates and screams at full volume. No theft is occurring. No threat is present. The alarm mechanism itself is simply broken, generating alerts in the complete absence of the triggering conditions it was designed to detect. A damaged peripheral nerve operates by identical logic. It broadcasts emergency signals continuously to the brain, despite the complete absence of any actual tissue injury or external threat. The pain your nervous system generates through this process is neurologically real and genuinely experienced. But its source is dysfunction in the signaling apparatus itself, not damage to the physical structures the signal is purportedly reporting on. Ibuprofen and similar anti-inflammatory agents work by suppressing the biochemical cascade of inflammation. They have no mechanism of action relevant to aberrant electrical signaling in a damaged nerve. Consuming them in this context does not treat the problem. It suppresses the symptom while the underlying nerve damage continues its progression unaddressed and unmonitored. A landmark investigation published in the New England Journal of Medicine established that painful diabetic neuropathy affects approximately 25% of the total diabetes population and is misidentified as arthritis, tendinitis, or age-related musculoskeletal degeneration in a substantial proportion of those cases. Every morning, before placing any weight on your feet, dedicate 5 minutes to deliberate gentle stretching of the foot and ankle structures while still lying in bed. Systematically flex and extend your feet through their full range. Rotate each ankle through complete smooth circles in both directions. Reach and gently draw your toes back toward your shin. These movements initiate blood flow into the peripheral circulation of your feet before the mechanical demands of weight-bearing begin. Every evening before sleep, provide your feet with 3 minutes of gentle therapeutic massage. Sustained light circular pressure applied progressively along the entire length of the sole and continuing upward through the ankle. This consistent mechanical stimulation supports both circulation and nerve sensitivity in the tissues that need it most. Sign number 8 functions as my clinical gauge of how far the disease process has already advanced. When I identify this finding during examination, I understand that the damage I am dealing with is no longer in its formative stages. The patient's reflexive response is almost invariant. "Doctor, I have always had cold feet. That is simply how I am built. My spouse has been reclaiming the electric blanket every winter for decades, and we have had a standing joke about it for years." I engage genuinely with that response, and then I ask the questions that change the frame entirely. Are your feet cold in the middle of July? Are they cold when you are buried beneath 3 heavy blankets? Are they cold when the rest of your body feels comfortably warm? Because those specific circumstances are where my clinical concern becomes serious and immediate. Persistently cold feet that remain cold irrespective of ambient temperature, cold during summer, cold beneath substantial insulation, cold when no other part of the body shares that sensation, constitute a strong and reliable clinical indicator of severely compromised peripheral blood circulation. The blood vessels supplying your lower extremities have undergone sufficient narrowing and loss of compliance that adequately warmed blood is physically incapable of reaching the terminal tissues of your feet in the volume required to maintain normal temperature. The explanatory model I find most effective with patients. Your vascular system functions as a central heating network distributing warmth through a system of pipes running to every area of your body. When those pipes narrow progressively from blood sugar damage, the thermal energy generated centrally never successfully reaches the most distant rooms. Those spaces remain cold in perpetuity regardless of how vigorously the furnace operates. The coldness is not a reflection of environmental temperature. It is a direct reflection of pipe diameter. The American Heart Association documents peripheral artery disease, the clinical designation for pathologically narrowed blood vessels, as affecting over 8 million Americans with diabetes identified as the single largest individual risk factor in its development. Persistently, cold feet represent one of its earliest and most reliable presenting symptoms. The single most effective countermeasure available to you is a 30-minute brisk, purposeful walk performed every single day. Not a casual stroll, a vigorous, arm-engaged, mechanically demanding walk that forces your cardiovascular system to drive blood actively and forcefully through the peripheral circulation of your lower extremities and feet. This sustained daily stimulus progressively strengthens the walls of the blood vessels, supports the development of collateral circulation, and over time demonstrably reverses a portion of the early vascular narrowing. If 30 consecutive minutes feels prohibitive, begin with 10 minutes and build progressively from that foundation. The singular imperative is to begin today, not tomorrow. Sign number 9 is the finding that receives virtually no attention anywhere, not in patient education materials, not in general health publications, not in conversations that happen outside a physician's examination room. I have genuinely never encountered it in a patient brochure. Most people walk past it every day of their lives. Many physicians who have not specifically trained their eye to look for it walk past it as well. Once you possess this knowledge, you will find yourself unable to not notice it. I essentially never need to point it out because patients arrive having never thought to look for it themselves. But when I conduct a thorough foot examination and turn my attention to the lower legs and the dorsal surface of the feet, I am sometimes confronted with a visually unmistakable absence, a region where hair growth has simply ceased. The patient directs their gaze downward and expresses genuine surprise. They had never noticed, and that is precisely and fundamentally the problem. It is a quiet sign, an easy sign to overlook, but its clinical significance is substantial and should not be minimized. Hair follicles are biologically demanding structures that require a reliable, consistent, adequate supply of oxygenated blood to sustain their ongoing production cycle. When peripheral circulation is meaningfully and chronically impaired by the vascular damage accompanying long-standing elevated blood sugar, the follicles populating the feet and lower legs find themselves progressively receiving less than they require to maintain function. The reduction is gradual. The follicles do not abruptly die. They simply slow, diminish, and eventually cease producing hair entirely over a period that may span years. The resulting visible hair loss is not a cosmetic artifact or an incidental finding. It is a surface-level marker of deep and progressive blood vessel deterioration that has been advancing silently and invisibly within the tissues beneath. The botanical analogy translates this most effectively. Picture each hair follicle as a small cultivated plant within a larger garden. When the irrigation infrastructure supplying that garden progressively narrows and eventually partially occludes the plants, do not collapse suddenly. They simply stop growing. The visible cessation of growth is the garden's only available means of communicating that its water supply has been compromised. Your lower extremities communicate their vascular status through precisely the same visible absence. Research published in the peer-reviewed journal Diabetes, Obesity, and Metabolism documented a statistically significant correlation between hair loss localized to the lower extremities and the presence of peripheral vascular disease in diabetic patients, confirming it as a clinically meaningful and persistently underutilized diagnostic indicator that trained physicians specifically know to examine for. Immediately following this video, conduct your own direct examination of your lower legs and the tops of both feet. If the hair density in those areas is observably and substantially reduced compared to other regions of your legs, or if hair is absent in those areas entirely, schedule a blood glucose test within this week. Not sometime this month, this specific week. The test costs approximately $12 at any accredited laboratory facility and is covered under Medicare. For the majority of people watching this right now, $12 represents the most consequential health investment they will make this year. A significant amount of ground has been covered today. 9 signs. 9 distinct biological opportunities for early detection before the disease process advances beyond the manageable range. And I want to share something with you with complete transparency. Among the most genuinely difficult moments in my professional life is sitting across from a patient who has displayed every single one of these 9 signs for 2 consecutive years and is sitting in my office today learning for the first time what those signs have been trying to communicate. Not because they were careless or indifferent. These are individuals who care deeply about their health and about the people depending on them. They were simply never given this information. You have now been given this information, and I am asking you to do precisely one thing with it. A single action. Tonight, before you retire, sit down in good light and look at your feet with genuine intentionality. 30 seconds of focused observation. Examine the skin surface. Look deliberately between each toe. Apply light pressure to check for areas of reduced sensation. Search for any wound, any break in the skin, any abnormality that should not be present. 30 seconds. That is the complete ask. And if anything you see or feel corresponds to anything on this list, contact your physician tomorrow morning. Not at your next scheduled appointment. Not when it becomes convenient. Tomorrow morning. Because the temporal window between early detection and manageable intervention is the single most valuable clinical resource available to you, and every week of delay narrows that window. You have invested years of consistent effort building the life you currently inhabit, your independence, your functional capacity, your ability to engage with everything that gives your daily existence meaning. Do not allow something as clinically addressable as blood sugar dysregulation to quietly dismantle any of that, simply because the right information never reached you at the right moment. It has reached you now. If this video delivered genuine value to you, share it on Facebook right now. Tag someone whose health you care about, a family member, a close friend, a neighbor you see regularly. You may be providing them with something they did not know they were missing. And if you want more conversations of this depth and specificity, I publish a new video every week on this channel. Subjects that carry real weight for your health after 60, the kind of substantive clinical discussions I have with my patients that rarely escape the walls of a medical office. Subscribe and bring someone you love along with you for the journey. I am Dr. Stanley Brown. Stay informed, stay proactive, and take care of those feet.